The first thing to say is that as regards the US and Europe, it's not that there's one approach in Europe. It's not that there's one approach in the US. There are 51 approaches in the US, 50 approaches of our different states, and an approach of our federal government. There are many different approaches. Some states deny, some states recognize. Similarly, in Europe, there are different approaches. Sweden adopted the approach of letting everybody do anything in the hope of building up herd immunity. It seems that that approach is not working well. In Britain, again, Britain's Prime Minister, Johnson, adopted an approach of denial. In contrast, in Germany, Angela Merkel, a wonderful prime minister, adopted a good policy towards COVID, just as she's adopted a good policy towards everything else. And an extreme example in Europe is Finland. Finland, because of their experience with the Soviet Union, the Finns, having been cut off from trade with the outside world, the Finns realized they have to be prepared for everything. And so in Finland, there's a committee that meets every month. Each month they consider a different possible disaster, and they discuss how to prepare for the disaster. Among other things, Finland stockpiles everything. And so, of course, Finland stockpiles face masks, but Finland also stockpiles fuel for cars, and Finland stockpiles wheat, and Finland stockpiles medicines, and Finland stockpiles chemicals. Finland, because of its experience, is prepared for everything. And therefore, in answer to your question, how do I compare the responses of China, the United States, and Europe? My guess is that China is more unified than either the United States or Europe. And in the United States, we have 51 approaches. And in Europe, with 48 countries, we have 48 approaches.